Welcome to the Peptides and Longevity podcast, redefining aging and transforming health. Each week, Dr. Kent Holtorf will dive into groundbreaking science, innovative therapies, and the future of health and longevity. Alongside visionary physicians and experts, we'll explore how peptides, cutting-edge medicine, and lifestyle strategies can redefine the way we age. Get ready to transform your health, optimize your vitality, and unlock the secrets to a longer, healthier life. Let's get started.
Hi, this is Dr. Kent Holtorf. I want to do just a very brief introduction to peptides and basically the background, the different classes of peptides and their mechanisms, so that when the speakers are, we're all talking about different peptides, like, what the heck do each of these do? Because sometimes they can, just reel off a bunch of different names. It's like, what the heck is that? So I want to go through and put them in classifications for you and understand some of the basic underlying fundamentals of peptides. So it's called Peptides 101. And just a little disclosure here. So let's go through what we want to kind of achieve here is understand what the heck is a peptide, and then understand the multiple types of peptides and what their targets are to support normal functioning and the core aspects of dysfunctional systems that are involved with aging, poor lifestyle, toxin exposure, and to address symptoms of the multi-system disease. And understand how peptides differ from hormones, their mechanism of action, and understand the basic classes. We have immune modulating, rejuvenating, and these are pretty arbitrary, but sleep, brain, basically nootropics, antimicrobial, mitochondrial or energy. They have the growth hormone releasing hormones, melanotropic, which are great at really anti-inflammatory, then anti-aging, anti-inflammatory, and other ones. So they all cross over and they work so well together, but we'll try to make some sense of it and put them in different classes for you. And understand really the underlying issues of how the heck we get sick and why we age, and how peptides can aid in retarding that basically progression to, multiple illnesses, that multi-system illness, becoming frail, autoimmunity, cancer, cardiovascular disease, just basically loss of muscle mass, increase body fat, insulin resistance, decline in memory, basically your immune system starts declining. And so we'll see some of the things that when you look like, damn, why aren't we addressing those when you look at what really changes as we age? And we see that so many conditions are associated with, this immune dysfunction that we find with chronic aging, including stress, allergies, toxin exposure, lifestyle, certainly mold, obesity, insomnia, sleep apnea, where you get this Th1 Treg. So think of everything as basically a teeter-totter. So you got Th1 on one side, Th2 on the other side. Th1 gets stuff inside the cell, Th2 gets stuff outside the cell, and usually they're imbalanced. But as we get older, the Th1 gets too low. So now you can't fight intercellular infections or cancer, but now you have all this inflammation, right? But also they found that the Th1 goes along with what's called Treg, which is kind of the balancing immune system. It keeps your immune system going too far. So when that gets messed up or isn't high enough, it puts the brakes on everything. So then you get autoimmunity. And then there's on the other side with Th2, so you got Th1, Treg, Th2, Th17. Th17 really is that autoimmune, the inflammatory driven side of the immune system. And as we age with any illness and disease, it starts going like this. So you have all this Th17, Th2, not enough Th1, not enough Treg. So we're going to talk about how that snap that back to become younger and really have a younger immune system, which then perpetuates everything healing, lack of this degenerative diseases that we see with aging. And really, we'll talk about, gut, how the gut is so important in the gut-brain axis. So I just want to, bring up these topics so when they're talked about that you have heard of them before. So what the heck is a peptide? It's basically a protein, but it's arbitrary. If it's less than 50 amino acids, so it's amino acids connected. If they're longer than 50, some people say 40 or 50, they're a protein. If they're less, they're considered a peptide. So they're small proteins. Now, how do they differ from hormones? People say, well, is peptide a hormone? There are a lot of peptides that they're called hormones, and vitamins that are actually hormones, but peptides will generally work on the cell surface. They work quicker. They work what's called pleiotrophically. They have cell signaling, and they signal multiple messengers and have multiple effects. It's much like a vitamin. So when you say, what does a vitamin do? It has multiple effects. And actually, it's actually much safer. It sounds like, wow, we don't know what it does. It has so many things. But, drugs tend to be very targeted. And that's when you get into problems, is that it blocks one thing, but you don't think of all the other things that it basically affects when you're just trying to block one thing. But the peptides will generally have multiple effects, and they also work epigenetically and turn on and turn off genes. So when you look at your genome, people think our genes are what's going to happen. But really, when you do a genetic test, your genes are about 20% of what's going to happen to you. 80% is what affects those genes epigenetically. So, whether it's lifestyle, toxins, pesticides, plastics, exercise, medications, whether they be hormones, peptides, all those things acting on those genes can turn them on or turn them off. For instance, a peptide may turn off 100 genes and turn on 200 genes. So when you have, let's say, oh my gosh, I have an ApoE4, then we get Alzheimer's. But if you turn that gene off, then you're fine. You only have 20% is set in stone, 80% is not. So, and then hormones, in contrast, actually go into the cell, go into the nucleus, work on nuclear receptors, very slow on, slow off. So, and they tend to have broader effects and actually be, more side effects and not as safe. And some of the peptides, you can give 1,000 times the normal dose and there's no toxic effects. Not for all of them, but some of them, it's like, you can't do that with water. But so they are in general very safe. And they work basically in a different mechanism. They're very synergistic with other peptides, hormones. I don't know, even off the top of my head, any peptide you can't give with X treatment. So peptides, we found out, we thought, hormones are the master regulators, but we found that peptides really regulate almost every process in the body, and they're very tissue and cellular specific, and they're more precise than hormones. Hormones are kind of like hitting it with a bat, and this is like, with a scalpel. They didn't have tissue specific effects, while hormones have more broad effects. Again, mentioned extremely safe, and more what going to clinical trials. The drugs coming out are peptide hormones or peptide, whether they be antibiotics or, basically a big thing now is mitochondrial peptides and things for diabetes. About 30% now, I think it is, are coming out. It'll probably be about 50% of new drugs coming out are peptides. So what are the general categories? Again, this is somewhat arbitrary. You can break them down in so many different ways, but let's talk about immune modulating. We talked about that Th1, Treg, Th2, Th17 balance. So thymosin beta 4 or TB4 frag, they basically are kind of even, though they'll increase Th1 and lower Th2, and do both of those. The difference is now thymosin beta 4 is a very long, for a peptide, it's 43 amino acids. So it has multiple what they call domains that do different things. And one of the domains actually stimulates mast cells. Now, if you give TB4 to someone who has actually mast cell activation syndrome, too much mast cell activation, it will probably help, even though it has a domain that stimulates mast cells. Because overall, the upstream effect, modulating the immune system, will actually suppress the mast cell activation. But the TB4 frag is what it is. It's taken out the part that has all the immune modulating, all those good parts and the rejuvenating effects, but leaves out the part that stimulates mast cells. It's also much smaller, so it crosses the blood-brain barrier, gets into actually biofilms. It gets into very small nooks and crannies in the body and has a much better effect in a lot more places. BPC 157 is it's a core treatment, body protection compound. It is basically produced in the gut, and it's one of the few peptides that are stable in the gut. Even though it's a longer peptide, it actually absorbs very well and is shown to be equal potent whether you give it orally or subcutaneously or IM or however you inject it, IV. It's for the same dose. It has the same effect if you take it orally or systemically. So let's say you have a knee that hurts. The same dose orally in the study show that it will work the same as if you give it IV. Now, I think, if you inject it in the joint, it's going to be more compressed in that joint, then you'll get a higher level of reduction in inflammation and all that in there. But in general, it will be the same as, let's say, subcutaneous or oral, the same dose with the same systemic effect. And they've shown that for, studies on models of Alzheimer's and, whether it be diabetes and metabolism, tendons, joints, all those things. Thymosin alpha 1 is actually an approved peptide. It's approved as an orphan drug here in the US, but so you really can't get it, but it's approved in over probably 30 countries for everything from cancer to basically infections like hepatitis B, things like that. So it really increases that Th1 and really kills those intercellular infections. Thymulin and thymogen are other thymosins that are produced in the thymus gland, which we're going to talk about. And they all have generally similar effects, but a little difference. Some have more modulating effects. Like for instance, thymosin alpha 1 is really on Th1, raises that. Thymosin beta 4 basically is more even, will raise Th1, lower Th2 and that Th17. Now, thymulin is kind of like thymosin beta 4, but it is more anti-inflammatory, I think. And it's probably one of the best for Herxheimer reaction, although the other ones work as well. When you add like TB4 or TB4 frag with BPC, get BPC lowering that Th2, and then the TB4. And now the thing that TB4 and TB4 frag has over thymosin alpha 1 has more rejuvenating effects, more growth factors, where thymosin alpha 1 is more, kind of that boosting that immunity for infection. I put epitalon and pinealion. They're pineal hormones, and they actually will stimulate the thymus to make thymic hormones. And what's interesting, you can take out the pituitary and give the pineal hormones, and it will stimulate the thyroid. So it will somehow stimulate the TSH receptor when there's no pituitary making TSH. And it's really a balancing hormone, one probably the best anti-aging hormone. Studies show when you take it, they've done studies, basically people over 65 years old, significant cardiovascular disease, followed for 14 years, dramatic reduction in mortality, morbidity, they live longer. Their actually cardiovascular function gets better while the people on standard therapy get worse. And they basically have dramatically less cancer, heart attacks, and they live longer. Sleep peptides, some of these are just a miracle for people who can't sleep like myself, is a combination of the epitalon or pinealian, which again, the pineal hormones, and those are shown to actually, just those will raise your melatonin levels for an older person up to youthful levels just by itself. But they have much more effects than that. Now, when you add that to delta sleep inducing peptide, which what it sounds like a sleep inducing peptide, you add that, and then like a growth hormone, secretagogue, that increases growth hormone, or AOD, which is anti-obesity drug, but it's a fragment of growth hormone. It really resets that sleep, the whole system, where you can actually get deep sleep, that deep wave sleep. So the delta sleep inducing peptide, it's not like a sleep med where you fall asleep. It changes over time, takes a couple of weeks, but it kind of resets that where you can actually get sleep. We find that combination of those three, of the basic pineal hormone peptides, epitalon, pinealian, delta sleep inducing peptide, and either growth hormone secretagogue or AOD or growth hormone, and you get great sleep or significant improved sleep with deep wave sleep after a couple of weeks. So there's a lot of, talk about, all the growth hormones, secretagogues, there's growth hormone releasing hormones, growth hormone releasing peptides. It shows they work better together. It's very complicated. I won't go into that, but just so you know that. And the problem is people start associating that with like bodybuilders and things like that, but you can't overdose, because if you take too much, it doesn't basically raise your growth hormone more than it should. Excuse me. And then AOD is a fraction of growth hormone. It does not increase IGF-1, which is how most of the effects of growth hormone, but it has its own rejuvenating effects, and also does boost metabolism. So hence anti-obesity drug. Brain peptides, Cmax and C-Lank, those are shown to improve memory, attention, ADD, OCD. They increase brain connections, and all these have almost no side effects. I've never heard of any. Even healthy people, they improve, test scores and things like that. Cerebrolysin has been around for 40 years. It's basically based on porcine brain peptides, a combination, and it's been given IV for a long time, but now the FDA says you can't do it because it's now called, it's a biologic, so you can't give it IV, but or as an injection, but it does absorb orally, and the studies show that. And it's shown to help with traumatic brain injury, recover that, improve memory, autism, and increase brain connections, protect the brain from toxins, and so many great things with cerebrolysin. And there's a long history of safety and efficacy. Dihexa is a angiotensin 2/7 analog, basically that is shown to improve Alzheimer's and memory. Cortigen, another brain neurotropic, increases brain metabolism, and all these are very synergistic with, for instance, TB4, TB4 frag, and BPC are shown to protect the brain from traumatic brain injury, increase memory. And I know when we give people BPC and TB4, they go, God, I can think clearer. Or that's what they say a lot of times. The growth hormone secretagogues, yeah, we could spend a lot of time on this, but essentially now there's growth hormone releasing peptides and growth hormone releasing hormones, and they're shown to work better when they are used together. And then the anti-obesity drug, which is a fragment of growth hormone. And again, most of these peptides are naturally produced, but some are synthetic and some are drugs. For instance, like thymosin alpha-1 is approved as a drug. Antimicrobial peptides, LL37 is a big one, very broad range of antimicrobial properties that your body secretes. Actually, stem cells secrete them. It also stimulates stem cells. So again, it's a good vicious cycle. Thymosin alpha-1 is approved for infections because it raises that Th1. Thymosin beta-4 and TB4 frag also. BPC 157. All the studies have shown that it's very, I haven't seen any studies on bacteria, but every study on viruses shows, like, for instance, it outperformed acyclovir at 1/100th the dose. So it killed the herpes virus better than acyclovir at 1/100th the dose. But there's not that many studies on other things. So we find that it really helps with a lot of infections, but there's no studies to really back that up, but extremely safe. And rejuvenating, again, will bring in a lot of these peptides. BBC 157 increases healing. Want to give lectures on it and show all the studies. It's kind of embarrassing. It's kind of like snake oil. How can it help everything? For everything from Alzheimer's, joint pain, autoimmune disease, skin problems, any inflammation, it does so many things. And the TB4 and the TB4 frag, again, immune modulation, the epithelion and pinealion, again, will stimulate the thymus, but also has even higher upstream effects. For instance, working on the pain centers and the sleep center. Delta Sleep does, like what it says, is a sleep center, but it's very anti-inflammatory. So one of the things it likely does is lower the inflammation in the hypothalamus, and that really helps you get deep sleep. So all these people with Lyme and chronic infections, they have inflammation in the hypothalamus and they can't sleep. They're just wired. So it is great at lowering inflammation there, as is the melanocortins, which we'll talk about, especially KPV, which can actually get in there. The growth hormone releasing hormones, growth hormone releasing peptides will actually do the same. Mitochondrial peptides. There's so many studies now in trials with boosting mitochondrial function because it is a core cause of aging. Their cells don't have enough energy. Their immune system doesn't have enough energy to fight infections, to fight cancer. And actually it's called autophagy, where they're called senescent cells. They just kind of sit there and they're dysfunctional, and the mitochondria get dysfunctional, and they start secreting all this reactive oxygen species, a lot of oxidative substances, and so become very attacking the body with all these oxidative compounds. But boosting the mitochondria actually reverses that. So, for instance, there are also any chronic illness, especially lots of studies on Alzheimer's, Parkinson's, even in terms of muscle strength, that you want mitochondrial function. You need energy for all these things to work. So there's MOTS-C, which actually usually use an injection twice a week or so, 5-amino-1-MQ, which we've had really interesting success with kind of psychiatric issues such as OCD, ADD, depression. For instance, we had one patient who basically pulling out, young girl, all her eyebrows. And after 3 days on 5-MeO-1-MQ, she stopped. And humanin, which has some amazing things going on with it, and lots of clinical trials were for diabetes and all these mitochondrial things. You also boost metabolism. Your metabolism drops as you get older, so you get type 2 diabetes, obesity. Basically, there's not enough energy for all these systems to work. SS31 is in tons of trials. It improves mitochondrial function. It's basically an antioxidant inside the mitochondria. For right now, it's very expensive to get the dose that works, but a lot of great studies coming out on that. BPC and TB4 and TB4 frag being smaller gets into the mitochondria. Those are also mitochondrial boosters, and you'll see a boost in mitochondria. The melanotropic peptides, the basis is alpha melanocyte stimulating hormone. So you think of that as increasing melanocytes, right? So basically getting tan in response to the sun, but they're also very anti-inflammatory. And you'll find a lot of people, they just love laying out or getting the tanning beds because it just makes them feel good. And that's what we find is that it's very anti-inflammatory, boosts serotonin and dopamine, and things you can't really give alpha melanocyte stimulating hormone. It just breaks down very quickly. And there's melanotan 1 and then 2, which is available. You get tan, you lose weight, increase libido, increase erectile function. So it's kind of called the Barbie doll or the Ken doll peptide. But the problem is, if you're young, that's great, you get tan, but if you're older, it will bring out dark spots in that. So now KPV is a tiny tripeptide fraction of alpha melanocyte stimulating hormone that has more anti-inflammatory effects actually than the whole peptide, but it actually does not stimulate the melanocytes, so you don't get the darkening of the skin, which is good. Plus it's small, so it can absorb orally, can cross the blood-brain barrier, and we're having great results with that for mast cells, for autoimmune disease. PT141 is approved for libido in women. It just got approved. It's an interesting peptide. I don't know if I've ever seen it not work. It's a little strange though. There's a side effect of nausea, which does tend to go away. But for erectile function, nothing beats it. And then, some libido improvement. And again, it's approved for increasing libido in women. Side effects of nausea, you can get a local reaction. And it's interesting, when I was very sick and I would inject the peptides, I get this red mark, which looks like I was allergic to them. But as I got better, it went away. So really it was that abnormal Th2, Th17 that would basically react. But once I balanced my immune system, I could do the hormones. You especially see that with the growth hormone releasing peptides. And you'll see it looks like that you're allergic to them, but we see that really in the people, the Lyme patients, the Sears patients that have really abnormally balanced immune system. And those are also the people that do not do well with vaccines and get harmed with vaccines. So we are starting a vaccine risk mitigation program where we test and then modulate that immune system so you're less likely to get any problems from vaccines. I'm not an anti-vaxxer. Vaccines have done more for humanity than so many things, and they're a huge part of health and why we're here. But we need to talk about them just like every other drug. Hey, what's the good? What's the bad? What's the best way to take them? How do you lower your risk from vaccine injury? People want us to pretend, they're totally safe. They're 100% safe. which is ridiculous. I've seen people's lives, they've got a flu shot and they were totally healthy and they're bed bound and they're never the same, So, but that's not a small, very small percentage, but it happens. Doesn't mean, each person has to decide whether or not to take each particular vaccine. So you're preventing very serious illnesses, but some studies show you have 30% increase in autoimmune disease, obesity. So you're trading off those side effects for something that's really bad. So where is that point where you say yes or no? And I think it's different for different people. So again, I'm not saying, vaccines they're a good thing for a lot of people. A lot of them are good, but we may be giving way too many. For instance, why are we giving hepatitis B vaccines to a newborn? Are they going to start doing drugs and being a prostitute, when they're born? It's crazy, and it's shown to cause developmental delay and that. So, it's everything in moderation, and what's the safest way to do the vaccines is the question. And let's talk about immune dysregulation. So many things are associated with immune dysregulation, chronic infections, and that's what we see so much of. Again, Lyme, parasites, and you look at chronic fatigue syndrome, fibromyalgia, SEERS, mast cell activation syndrome. Their just immune systems are just way off. So we can look at someone's immune system and really know exactly how sick they are and the extent of their symptoms to a very high degree of accuracy. Stress. Oh, I give lectures on stress. Stress is thought to lower the immunity. It does not. It modulates it. It increases inflammation, that Th2, but lowers that Th1. Aging is a big problem. You just keep going like this. Dysbiosis, it's a vicious cycle. Any gut issues, cardiovascular disease, high cholesterol, post-traumatic stress. They basically have leaky brain, leaky gut, PMS even, insulin resistance and diabetes. They all have immune dysfunction. They all have low thyroid, even though they have normal levels. Obesity, they have immune dysfunction. They all have low thyroid. And most have autoimmune thyroid that's not detected on standard tests. Depression, just dieting. Dieting will wreck your immune system and actually lower your thyroid if you seriously diet. And then when you start eating normally, your metabolism does not go back to normal. So when people say they've wrecked their metabolism, they have, unless you do something about it. Neurodegenerative diseases, definitely migraines, inflammation, cancer, traumatic brain injury immediately just messes up the immune system. All diseases of aging, infertility. If people can't get pregnant, fix their immune system, give them some T3, oftentimes some heparin. They have immune activation of coagulation, and they get pregnant naturally. And again, the abnormal immune system causes low thyroid. That's not detected on standard blood tests. So I spent about 4 hours doing these teeter-totter graphs here, so we can gaze at those for a second. So yeah, what's going on? So the thymus. So thymus is here on your breastbone, and basically about at age 15, you get a sharp decline in the thymus. It just starts involuting, just starts shriveling up. So you get that. Basically, it controls your Th1, Th2. So you start getting this. So you start aging much quicker. And then, so here is the graph. I think you can see my cursor, where right around, age 15, 14, 15, you just get this big drop in the thymus, and you just get this. And so autoimmune disease, cancer, degenerative diseases, neurodegenerative diseases, just start happening when you get older. People, yeah. So when you get to you're 40, you're like, oh my gosh, I'm getting all this stuff, especially at 50. You've had a couple of years with bad immune system. That's when all the bad stuff starts happening. Now, according to the Centers for Disease Control, the CDC, approximately 80% of aged individuals are afflicted with at least one chronic disease as a result of the decline in a thymic-related immune function. So again, CDC, 80%. Just the thymus abnormality, people suffer from at least one disease from that. And what actually speeds it up? Obesity, calorie intake, toxins. The thymic and the pineal gland and age. So again, many things have negative effects, and then the subsequent immunity, age, genetics, inflammation, lifestyle is huge, toxins, pesticides, plastics, pregnancy, more times you're pregnant, hypothyroidism, low growth hormone, zinc deficiency. You hear a lot about zinc with the whole COVID thing. And then immune dysfunction can worsen and also be associated with thyroid dysfunction that's not picked up on standard blood tests. You're much more susceptible to infections. Toxins are a big issue, mold toxins, mycotoxins, plastics, pesticides. We're just bombarded with all this stuff. EMFs, don't get me started on all that. So you get autoimmune disease. So this is basically that high Th2, your body starts attacking itself. Increased cancer risk, depression, bipolar, obesity with all that inflammation. So inflammation, hypothalamus, you basically, your brain doesn't, basically when you gain weight, you increase leptin. Leptin should go back to the brain, tell the brain, hey, we got stored energy. We don't need to eat any, we need to slow down our eating. We need to increase metabolism, all that, but the brain doesn't see it. So the brain thinks the body's starving. So it lowers your thyroid, increases your appetite, lowers your metabolism, and tells the body to store fat. So inflammation in the brain does that. PCOS, gut dysbiosis, we're getting all the chronic fatigue syndrome, fibromyalgia, musculoskeletal degeneration. People become frail. They become weak and frail, and they break a hip, and that's how they end up with pneumonia or whatever in a nursing home. Neurodegenerative diseases, and they have terrible immune system, terrible mitochondrial function, and they're all infected. It just infections, these low-lying infections that no one tests for, is speeding up aging so much. It is so common. Stress, again, we talked about stress. So you look at stress as not lower immunity, it modulates it, and you get actually the cortisol, corticotropin releasing hormone, which stimulates ACTH to make cortisol, hugely stimulates mast cells. So stress increases inflammation, increases mast cells. So you want to, and all these, there's all these amazingly smart geeks that just are in the mast cell activation syndrome, which no one else will touch, but they're still just focused on direct suppression of mast cells. But you really want to look upstream, and that's where you get the best effects. So especially the people with SEERS, mast cell activation syndrome, chronic fatigue syndrome, Lyme, and restoring that, looking at that Th1, Treg, Th2, Th17 balance, much more beneficial than trying to suppress the mast cells with antihistamines and those things. They work, they help, but you can do much more. And there was a misnomer. If you read, you'll see there's Th1 autoimmunity, and for instance, type 1 diabetes, multiple sclerosis, Hashimoto's, it's felt to be type 1, where Graves is type 2. But, and I was taught that, I'm like, well, why do they respond to the same treatments? Like even this low-dose altrexone, modulates the immune system. It's type 1 or type 2, wouldn't it be different? What they found is that it was not Th1. It was actually, it looks like Th1, but it was actually a subset called Th17, which actually is more on the Th2 side. So that whole Th1 autoimmunity is completely wrong. It's a Th17. And Th1 actually suppresses Th17. So thymosins, again, as that involutes and you stop secreting thymosins, that's when your immune system goes awry and you start feeling the effects of aging. and you lose all that healing, restoring properties that's required to maintain normal antimicrobial activity, mitochondrial function. The thymus works in so many different ways to a secondary messenger for healing. It's anti-inflammatory. Again, without the thymus, you're just up here with so much inflammation. Nitric oxide, which dilates the vessels, antioxidants, boost stem cells. The thymus is needed to maintain healthy gastric mucosa. Also, people have brain on fire now. Most people are stressed, they can't sleep, they got ADD, they got depression. It's brain inflammation. So it's that immune system, that Th2, that's activating the microglia in the brain to modulate that brain inflammation goes away. It also binds and blocks the effects of toxins, such as mycotoxins. So people with mold toxicity, and EMFs actually make it worse and actually speed the growth of mold, by the way. And the electromagnetic fields are actually very activating the brain and the microglia. So it's like you don't get deep sleep when you're around EMFs. I recommend you turn off your Wi-Fi at night. Boost natural killer cell function, which is that Th1. Also those thymosins, especially the small ones like thymosin beta-4 frag, gets into the biofilms and busts them up. So gut-brain axis, you got to think of it as basically a two-way street. We're finding so many things. The gut controls so many aspects of our health. We've evolved with these organisms for millions of years, and we can't live without them. And we find when that gets messed up, it messes up the health of the body. But also, when you have an unhealthy body, it messes up the gut. So, they've done, the studies where thin people have a certain set of bacteria in their gut, and obese people have a different set. If you replace them, then the skinny people get fat, the fat people get skinny, but they tend to go back to where they were because of the dual aspect, where the unhealthy body actually also controls what bugs are going to grow in the gut. So it's much more complex than, hey, just take these probiotics. And then when you get into the microbiome, there's, we have more bacterial DNA than we do human DNA, and we have way more viral DNA than we have bacterial DNA. So the viruses that actually, they're called bacteriophages, they're very specific to the bacteria. They don't harm us, but they go after the bacteria. But they'll actually are a major part of controlling the level of the different bacteria in the gut. And it's a whole new, we think like this whole new revolution of the microbiome. Just wait till we start learning about the virome. It's one of those things that the more you know, the more you don't know. But if you have a leaky gut, so leaky gut is such a problem with all processed foods, all the inflammation, many of the peptides, BPC, the thymosins, will fix the tight junctions, and one of the best things to heal the gut. Remember, it's a two-way street. And just shows here really a big part with the vagus nerve. It affects, they say gut-brain axis, but it's really gut-everything axis, because it works at really all levels, but the brain will affect everything else. But it just inflammation. If inflammation in the gut, you have inflammation everywhere else. And basically, unhealthy gut, you're gonna be unhealthy. So just in summary, a wide range of diseases really have this commonality of this low Th1, Treg, high Th2, Th17. And a key is bringing that back to a youthful, healthy balance. And remember, the gut-brain axis is a core contributor to overall health. And the peptides can control many aspects of this. And improper functioning or deficiency, such as the thymus is gone, why not replace the thymic hormones? And can really be a major contributor to all these diseases of aging. So that's it. I hope that gives you a little background. Sorry for my raspy voice. But when you listen to these talks, so you kind of have a sense of, where everyone's coming from with the peptides. So again, I hope you're enjoying and I hope you're finding it useful. And thanks for joining us. All right, goodbye.
Thanks for joining us on the Peptides and Longevity podcast. If you enjoyed today's episode, don't forget to subscribe, share, and leave a review. It helps us reach more listeners passionate about optimizing their health. For more insights, resources, and updates, visit our website at www.holtorfmed.com. Together, let's embrace a future of health and vitality. Until next time, stay inspired and keep thriving.